Hi guys, sorry it's been a while since my last video. I've been really trying. I've tried a couple of times to make this video, so now I'm doing it on my camera because it's the only way I can get it working, although they take ages to upload. So today I'm looking a bit of a mess, but I'm going to try and make some videos for you and get back into it. I started placement, this is my third week now, so I wanted to do it pretty much every week, but I haven't been able to do that. So I'm going to, in this video, be talking a little bit about the placement that I'm on now, which is a community placement. So I'll go on and tell you in a minute. I just wanted to say thank you for all the people that have commented on my videos and subscribed and everything, and hi to you. And sorry that I haven't, if I'm slow at getting back to you and stuff. And I hope you're enjoying my videos. Please give me your feedback, it's really important to me. Anyway, on with this video. I'm going to try and be quick, guys. So this placement is for 5 weeks. So as I said, I'm in my third week, 2 weeks left after this. I'm doing normal hours. I do Monday to Friday, 8:30 till 4:30, which in some ways, I keep changing my mind about this because I was really excited to have normal hours and being able to have my weekends and evenings, which is really nice. But also, when you're doing shift work, you get days off in the week. So although I've got every evening free pretty much, the only days I get off is Saturday and Sunday, and they tend to be so busy. Like this weekend, Sunday I'm always at church, so I'm just not home all day, which I love and which is important. It's my day of rest. I don't do any work. And then Saturday, this Saturday just gone was just so busy. I didn't get my washing done. My room is a mess. I'm having to write essays and stuff, but I'll talk about that in another video. Yeah, so it's been really hard. This is why I found it difficult to make videos. So I don't really know what I prefer, shifts or working 5 days. If you've got any opinions on that, write in the comments. So I don't know how much you guys know about my other placements, but scroll through my videos and they will, it'll be there. But this one is very different. The people that I love, the people that I work with, are lovely. I really got along with everyone. It's a really small team. There's only actually 3 community nurses, and then there are a few others that are specialist nurses. So my mentor is really nice. I really get along well with her. And there are bits that I like about the work, bits that I don't like so much, and I'm just going to talk you through that. So obviously I've mentioned that the people are lovely. Also, I love working one-to-one with the children. So sometimes we need to see 6 or 7 patients in a day, but it's not like when you're on shift and you have 7 all through the day and you get to the end of the shift and you hardly know their names. You kind of know them by their bed numbers or their condition, which is horrible. When I started nursing, I promised that I would never be like that. But you just do, it's one of these things. Whereas this work, you'll have those patients, but you have them one at a time. Because you're going to their homes or going to their schools, you're kind of with them, do what you need to do, and then come out and go to your next patient. And I really like having that time with them. And you aren't just quick in and out 5 minutes. You're kind of there, kind of 20 minutes to half an hour sometimes, even longer than that on other occasions. I'll talk a bit about what I've been doing in a minute, but a little bit about some of the things that I don't like. Is that basically you don't see many patients in a day. So on one of the days that I did in my first week, I saw 1 patient all day. Often it's about 3 or 4 patients. I think on average it's been about 4, which is fine, but it kind of depends what you're doing. Whereas in placement you're seeing so many people and they're changing every day, whereas on community you pretty much see the same patients every week if you're working with the same nurse. So you get to know them really well and get to build up a relationship with them, which I love. But in terms of learning, I do learn. I'm learning every day that I'm there. But on the ward, there was a massive amount to be learned, and that was really overwhelming, but really good for you as a nurse. So that's kind of, I suppose, one of the negatives, but I'm not saying that I don't learn anything, because I've learned so much, and I'm able to learn it in a better way because the nurses have a bit more time. And also it's lots of driving, so I talk to my mentor in the car all the time, so that's really good, and ask questions and stuff. That's the other negative bit, that is lots of driving. In my first week I was feeling really sick, and I've started to take travel sickness tablets every day, though I haven't taken them for a while, but I just felt really nauseous in the car. Another good thing about this placement that I haven't actually put down that I'm going to mention is there's lots of what we call hub and spoke placements, where you basically can go to different areas. So in the building I work, there's speech and language therapy, physiotherapists, key workers, diabetic nurses, asthma nurses, health visitors. It's also linked with the hospital, so there's stoma nurse there. I went to a diabetes clinic on Monday, yesterday, and so there's lots of other places that I can go, alternative places, which is really good. So some of the things that I've got to do so far are lots of dressings, lots and lots of oncology patients, lots of patients with ports, which are just kind of things that they put under the skin, usually in the chest cavity, so that you don't keep needing to put needles in the vein. You just put the needle straight into that and it goes into the bloodstream. So you take blood from there, you give medicines through there, and it's just a lot more comfortable for the patients, because they're having to have needles all the time, so their veins collapse and things. So you see lots of ports, lots of Hickman lines, lots of PICC lines. So that's really good. I've been learning lots about that, and they've got a mannequin that I'm hopefully going to see soon, and get some training on that. Right. I've seen a few NG tubes, PEG tubes, gastrostomies, done some gastrostomy dressings, then a few normal ORBs, kind of BP and O2 sats mostly, and injections and medications that we're giving patients as well. So hopefully in this time I'll be able to learn to give injections. I know tomorrow I have an appointment with the diabetes nurse, and she's going to give me some training. I went to a kind of centre for under 5s with special needs. I'm having opportunities to go to lots of places. I'm with a palliative care nurse next week. I'll be with a health visitor soon as well, so there's lots and lots of opportunities, and I'm really enjoying this placement. I really hope this video hasn't gone on too long, but I'll be making another video really soon anyway, pretty much straight after this one. So I'll see you in my next video. If you've got any questions, just comment below and I'll make more videos to do with this placement and keep you updated. So see you in my next video.